Older adults are the most frequent victims of two cardiovascular emergencies, heart attack and stroke. A heart attack occurs when the blood supply to part of the heart is severely reduced or stopped. This often occurs when the coronary arteries that supply the heart with blood become blocked.
Early recognition and treatment of a heart attack provides the victim the best chance for recovery. The signs and symptoms of heart attack include chest pain or pressure which may radiate to the arm, neck, jaw, or back. A sudden onset of pain is sometimes the first, last, and only symptom that some victims will have. Shortness of breath, rapid or irregular heartbeat, and nausea, vomiting, or sweating.
A stroke occurs when there is a disruption of blood supply to the brain, such as when the cerebral arteries that supply blood to the brain are blocked or rupture.
The signs and symptoms of a stroke include sudden onset of a severe headache, loss of consciousness, facial droop, and abnormal speech.
The most appropriate care for a victim with a possible heart attack or stroke is early treatment at the nearest hospital emergency department that offers emergency cardiovascular care. This is often best accomplished by calling 911. Trained dispatchers can provide you with instructions over the phone for initial care before EMS personnel arrive.
Additional initial care for a heart attack includes having the victim rest in the most comfortable position, loosen any restrictive clothing, assisting with any prescribed heart medication, such as nitroglycerin, providing reassurance, and monitoring the ABCs.
Additional care for stroke includes loosen any restrictive clothing, place the victim in the recovery position, provide reassurance, monitor the ABCs. Most poisonings are by ingestion and include liquids, household cleaners, plants, and most often, drugs. Poison ingestion is usually unintentional in children and, except for contaminated food, deliberate in adults.
To care for ingested poisoning, determine the age and size of the victim, what was ingested, how much was ingested, and when it was ingested.
If a corrosive or caustic substance was swallowed, immediately dilute it by having the victim drink at least 1 or 2 8-ounce glasses of water or milk. For other poisons, do not give water or milk to dilute unless instructed by a poison control center. For a responsive victim, call a poison control center immediately. Some poisons do not cause harm until hours later, while others do damage immediately. Most poisonings can be treated by following the instructions given over the telephone by a poison control center. For an unresponsive victim, check the ABCs.
If the victim is breathing, place her on the left side. In this position, gravity will delay the poison's absorption.
This position also helps prevent inhalation of foreign materials into the lungs if vomiting occurs. Induce vomiting using syrup of ipecac only if a poison control center or a physician advises it. Give activated charcoal if a poison control center advises. It acts like a sponge to bind and keep the poison in the digestive system, thus preventing its absorption into the blood.
Normally, a victim should not be moved until he or she is ready for transportation to a hospital if required. But there are times when an emergency move is needed. These include fire or danger of fire, explosions or when hazardous materials are involved, or when it is impossible to protect the scene from hazards.
When moving a victim in an emergency, a major danger is aggravating a pre-existing condition. If you suspect that the victim has a spinal injury, consider using one of these 3 methods. A shoulder drag can be used for short distances over a rough surface. Stabilize the victim's head with your forearms. An ankle drag is a fast method of moving a person over a smooth surface. A blanket drag requires you to roll the victim onto a blanket and pull from behind the victim's head. Methods for moving victims without a suspected spinal injury include human crutch,
cradle carry,
firefighter's carry,
packstrap carry,
and the piggyback carry.
You can use any of these methods depending on the victim's condition and your ability to perform it.